When most of us think about starting therapy, the door usually slams shut at the price tag. The baseline assumption is that mental health care is an unaffordable luxury that will drain hundreds of dollars out of your pocket every month. But even if you have the budget, traditional in-person therapy demands a massive amount of logistical heavy lifting. You are carving out 2 hours of your day just to get a 50-minute session. That means fighting rush hour traffic, negotiating time off work, and finding someone to watch the kids while you sit in a waiting room. We can measure these barriers using what we'll call the Therapy Friction Point Scorecard. On the left, we have high financial cost. On the right, massive logistical effort. When both meters max out, the result is total paralysis. So, are you forced to pay a massive premium to buy back your convenience? Or is there a viable way to bypass these friction points entirely? Many Georgians remain stuck because the perceived cost and the friction of traditional scheduling feel more daunting than the actual numbers on a billing statement. To see what modern mental health care actually looks like, let's examine Coping and Healing Counseling, or CHC. They are a statewide practice built specifically around 2 things: maximizing insurance utilization and delivering 100% virtual care. We are going to use CHC's model as a test case to find out if the average Georgia resident can actually eliminate those friction points we just talked about. To do this objectively, we will use an evaluation matrix. This framework lets us break down the specific inputs, the final outcomes, and the mandatory compromises required by this model. Because resolving these barriers isn't magic, it requires the patient to accept specific trade-offs regarding how they receive care and who they see. Looking at this matrix table, let's start with finances. Medicaid input means a strict $0 copay. The trade-off? You must stay within CHC's network. Commercial plans like Aetna, Cigna, or Humana yield a $10 to $40 copay. The trade-off here is initial administrative friction. You must verify eligibility before beginning. Compare that $10 to $40 reality against the assumption that you'd have to pay $150 or more out of pocket, and so the financial friction drops dramatically. An affordable session is structurally possible for most insured Georgians. You just must be willing to play by basic network rules instead of using cash. Now, let's flip to the logistical side of the matrix and look at CHC's fully HIPAA-compliant telehealth model. The outcomes are obvious: 0 commute time, 0 gas money spent, and no transit childcare costs. As this map of Georgia illustrates, this model instantly opens up specialized care to all 159 counties. It completely dissolves the geographic borders that usually restrict rural patients to whatever small clinic happens to be in their town. But there is a strict logistical trade-off. You completely lose the physical, in-person clinical environment. The responsibility for privacy shifts entirely to you. You must independently secure a quiet, private space in your home, car, or office for the session. In a traditional model, you're paying the clinic to guarantee that confidential, soundproof physical space for you. Here, you have to engineer it yourself. Telehealth removes the time poverty barrier, though it shifts the burden of securing a safe environment directly to you. Next, we have to look at the actual clinical capabilities of this model and what types of care translate effectively to a screen. CHC handles high-demand specialties. They treat anxiety, depression, trauma, grief, severe stress, and relationship issues. Because they recruit statewide, patients get access to a culturally diverse team of licensed clinical social workers, professional counselors, and marriage therapists. However, there is an absolute demographic constraint. CHC's practice is strictly limited to adults and teenagers aged 13 and older. That creates a direct trade-off for families. If you are a parent seeking play therapy for a child 12 or under, you will have to seek out an alternative local in-person clinic. The telehealth model scales specialized care for adults and teens highly efficiently, but it simply does not work for pediatric cases that require physical interaction. Let's build the scenario match decision tree to see if this fits you. First filters: are you in Georgia and 13 or older? If yes, continue. Final filter: do you have Medicaid or commercial insurance? Yes funnels you into the high match profile. This profile fits the time-poor professional who needs to schedule sessions during their lunch break, and the budget-conscious Georgian who requires absolute minimal copays to make care sustainable. Conversely, the low-match profile includes patients requiring intensive in-person psychiatric observation or parents looking for early childhood therapy. Our evaluation shows that for residents with the right coverage, the high out-of-pocket costs typically associated with therapy effectively disappear. If you land in that high match category, your next step is straightforward. Call CHC at 404-832-0102 to verify your exact benefits. It takes minutes, requires zero commitment, and costs you nothing to ask. Getting the hard data on your own insurance coverage is the mandatory first step to unblocking action. Once you know the real numbers, you can make an informed investment in your own mental health.